Today's Bayside is meant for everyone that experiences back and neck pain. Erica Rosenthal is with the Back Pain Centers of America, and she connects with people searching for solutions with top spine specialists. If you already know what I'm talking about, then you definitely want to tune in because the next 30 minutes is for you. Identifying issues of back and neck pain, well, that's what we're going to be tackling today on Bayside. Good morning and welcome to Bayside. I'm your host, Shelly Sanders. We are going to be talking all about back and neck pain. Back and neck pain. It affects so many people. Yes, even me. I'm telling you, I'm so happy to hear that you guys have brought some solutions for us. I've got with us Dr. John Solomon and, of course, Erica Rosenthal. Welcome to the show.
Thank you, Shelly.
This is a topic that can really, back and neck pain can just mess up your entire day. It can throw you off. It can really interrupt your sleep. There's so many issues. I talk about it like I know it because sadly I do. From time to time, it's just like, what is that?
Well, it affects millions of Americans, and it affects all of us at some point. So, for people who are in chronic neck or back pain, it not only affects them and their livelihood and lifestyle, but it affects their entire family.
Sure.
So it's a big issue.
So let's talk about that issue. So it's almost like a ripple effect, from my understanding, in the way that you guys look at it. Let's talk about those ripples. Yes, it can affect your family. I mean, if you haven't slept because you're in pain, you are actually in pain, so you're uncomfortable. Now you're grouchy, you're firing off or saying things to people that you wouldn't normally do. Pain changes people.
Absolutely.
So let's talk about that and then going even further.
Sure. We see a lot of patients with, back pain and complaints like that. We see mothers, we see athletes, we see hardworking men out there just in the construction field that when they have back pain, they can no longer function as a mother picking up their baby. They could not function as an athlete doing their best they can, as well as just standing up. If a majority of your job is sitting or standing, sometimes that can be very painful for you just to do your job on a daily basis. And so we see a lot of patients with just those basic things.
Right, just basic pain, aches and pains. I've known people that have literally had their back go out, and they can't get up off the floor.
Absolutely.
People that you think are strong, virile people that you're like, what? Get up. Absolutely. What do you mean you can't get up? It's crazy.
Absolutely. As a surgeon, we see a lot of patients from all gamut of pain, from the spasm, the back spasm, to actual neurologic problems where they're having weakness. And it's really up to the physician surgeon to figure out how to manage these patients, because as a surgeon, not every patient is surgical. And actually in my practice, about 10 to 20% of patients are actual surgical. So we go through a majority of patients through non-surgical techniques. And a lot of patients do have a fear of surgery. But the fear sometimes can be unnecessary. But a good majority of patients with back pain can be managed in a non-surgical arena.
Sure. So let's talk to those people. There are those that this is just daily life for them. You become accustomed to the state that you're in. So with that being said, let's talk to that person. What would you tell that person? Is it unnecessary? It isn't something that they should just cope with? Or is this something that, hey, get it checked out? And if you don't, is there something that could happen as a result of not getting treatment or whatever your suggestion would be?
Sure. We do see patients that have accepted their life. They're like, I'm just going to have to live with this, whether it's pain, whether it's an actual motor problem, meaning I can't just move my hand anymore. I just won't move my hand. I just won't open jars. I won't do things that I should do in my normal daily life. And some patients have accepted that as that's going to be their life from this point on. And they don't have to. We recently took care of a lady who had a lot of numbness in her hands, and she just accepted it. I'm just going to have numbness in my hands. I'm going to have my son do things for me. You know, I'm going to have other people. And they live with this disability, and they don't have to. And so we see the worst of the worst when it comes to surgery. We see major spine compression or nerve compression. And some of these are reversible. And so what I've noticed is, as long as we educate our patients regarding the realistic expectations, they are understanding and they're willing to proceed with the procedure, especially if it's going to help them cope with their daily life.
Sure.
And so that's the biggest thing that I see in educating the patients initially, giving them realistic expectations, I think is very important, you know, prior to anybody undergoing any sort of procedure.
Sure. Now, from the patient's standpoint, do you see, or from your standpoint, do you see the patients, when they start to actually hear your message and hear that, hey, you don't have to live with that anymore, like there is a solution for you, do you almost see the weight lifted off their shoulders?
Before the procedure, I think there's a set of...
Sounds too good to be true, no way.
True. And they've already accepted the fact
right?
that they're going to have these disabilities. It's after the surgery where they say, oh my gosh, I forgot how it feels to actually touch something, or I could feel my hand now, or when I put my hand in my pocket, my hand feels normal. I could feel that. The basic things that we take advantage of, they are like, this is incredible. It's a life-changing event sometimes.
Wow.
You know, we did a research study a few years ago that was around how long patients live in pain before they seek treatment. And spine was very unique because it was 9 years that people would live as an average of time they would live in pain. And you dig into why that is, it's, as Dr. Solomon says, it's not having their questions answered, a lot of fear around, can I be paralyzed, or what can happen to me? And so they accommodate in their lives to learn to live with it and not do certain things. So after they get the help that they need, when they say, finally, I've had enough, I'm going to do something, then it's the simple things like walking around Walmart or holding a grandchild and being able to go to the park.
9 years, that's amazing, isn't it?
It is.
That someone just accepts it. I mean, how at what point do you, 9 years, I guess, that you finally, enough is enough and can't handle it anymore? And all the excuses that we give ourselves, right? From, well, I'm getting older. We heard our parents, our grandparents talk, oh, you know, that's getting old. I must be getting old.
Right.
From there to actually a form of disabling that you've done to yourself. Like, oh, well, I'll just live with the fact that I can't feel or can't hold my grandchild or whatever the case may be. And just how liberating that must feel. And it must be very rewarding to be on your side as well.
Absolutely.
Keep doing what you're doing, right? So in addition to 9 years of just the waiting of suffering, I mean, that's what it would be, 9 years of suffering before action has actually been taken, and in most cases, or in your case, surgery. Talk to me about the financial impact, because it goes deeper than that. This is why you should be concerned at home, or this is why you should take note if you have a loved one or anyone, because it is a community issue, because we're talking about time missed from work. We're talking about doctor's appointments. We're talking, there's a financial impact as well, right? Do you have an idea of that?
Absolutely. There are several issues that are there because it's not like people sit at home in pain and do nothing. I think people try conservative treatment first, and we want them to do that. If they go get a massage or chiropractic or acupuncture and that does the trick, then wonderful. It does for some and it doesn't for others. So it's that point when they go a step further and go to see a surgeon and say
Sure.
what pathology is here. That's where the long gap is in time, and so you have missed work. Financially, you have maybe missed vacations too,
Sure.
and just the quality of life changes.
Sure.
And it is a health care, because if they start taking pain killers, of course, we all know about the opioid crisis. And
I mean, so the
that's a
effects
cost.
are huge, and it could be, I think I read in your materials, $28 billion on an annual basis it's costing.
That's right.
Those are big numbers. All right, so you want more information? Don't worry, we're coming back after the break we're getting ready to take. But in the meantime, bust out your laptop or your smartphone or your iPad and log on to this website, backpaincenters.com. They've got great information. It's a wonderful resource for you. You can make an appointment with them or just utilize their website as a resource. Good stuff right there on that website. We'll have a link for you on ours as well. Don't go anywhere. Coming back. Welcome back to Bayside. I'm your host, Shelley Sanders. I've been speaking with Dr. John Solomon and Miss Erica Rosenthal, and we have been talking about back pain. I know in the prior segment, we were talking about just the length of time. The numbers really are astounding. I mean, when you think $28 billion is the financial impact on an annual basis, I mean, that sounds like decades. Oh, that is 1 year. That's the financial impact that back and neck pain has. And then we talked about how long, 9 years of suffering someone goes through, typically only because they're afraid of, I mean, it is a scary thought. Gosh, you're messing around with my spine. I don't know. What if it doesn't work? What are so many questions I can come up with just on my own. I can't imagine living for 9 years of pain and getting to that point, just how much fear is there. And I'm sure just the thoughts of like, gosh, I'm going to miss work from what's the recovery? What can I do? Will I be frozen? You know, just a million questions. So we've talked about that scary journey, but I love the fact that Erica, you said you've got a book. We're going to get to that. But just giving liberation to these people that have this much pain, because it's all a matter of just getting informed and realizing that you take your power back, right?
Exactly, Shelley, and it really is. The more information you have to take control of your own health, the better off you are. It's just collecting information, knowing what questions you need to ask. And instead of toughing it out, which as Americans, we tend to tough things out and say, I'm going to work, I'm going to take care of my family, put ourselves sometimes last. So, and just saying, I need to address this, right? It's okay, it's normal to have fear around it, and instead of toughing through it, just arm yourself with a little more information so that you can make the right decision for you.
Sure, and you can start doing that by looking at your website, listening to the show. That's a step. Going to, there are no, you know what, Dr. Solomon, let's talk about you've got a little mini clinic, if you will, that you do through your church, which thank you for doing that. Paying it forward. One of the things that I do want to stress here is that it's a beautiful thing to find, you know, normally companies will want to come on to promote what they do, when you're actually here from a personal standpoint to say, listen, take control of your life, and it doesn't have to be full of pain and suffering. So bringing it back to your mini clinic, you hold through your church. You guys pay it forward into the community. So tell me about that clinic.
Sure. We see patients of all financial classes, people who can afford, you know, to have a procedure through their health insurance. But there's a large majority of people who don't have health insurance, and they're underserved, and they still need assistance. So every quarter we hold a free neurosurgery clinic at St. George Coptic Orthodox Church off of Bush Boulevard, the St. Luke Clinic, and we see majority underinsured or uninsured patients for free as a service back to the community. And we manage these patients. You know, some patients are surgical, and we try to get some sort of funding for them, whether it's through state funding processes or just donations from other church members.
Now, who's eligible for that?
Anybody in the community who does not have health insurance.
Okay.
In the Tampa community, they could go to the St. George Coptic Orthodox Church, St. Luke Clinic, and be seen for free.
Okay. Is there information on the website for that?
There will, yeah, there is. We will have a phone number here for them to call, as well as the church website.
Okay. All right. So if you'd like more information, by all means, log on to the website you're looking at right there, backpaincenters.com. Backpaincenters.com, like Erica said. Be informed. Get your information. The pain does not have to continue. All right. You take a look at the website. We're going to take a short break. We'll be back. Welcome back to Bayside. I'm your host, Shelley Sanders. Are you living with back and neck pain? If you are, you don't have to be. That is the message you want to take away from today's show. Be proactive in your recovery. You don't have to suffer. Am I right, Erica?
Absolutely, you don't have to suffer.
Sure, and you don't have to be scared. Don't let fear be what's holding you back from getting on that path to recovery. Now, I know one of the biggest things for people is the fear of like, oh my gosh, surgery on my back. Oh my gosh, and I don't want that scar. Are they gonna just fillet my back open? What is gonna happen here? There are some really cool procedures out now that aren't anything like that. You want to talk about that, Dr. Sullivan?
Absolutely, absolutely. I think it's normal to have some sort of anxiety about a surgical procedure, and a lot of patients, they have that anxiety, and it's up to us to calm that and reassure them that, you know, although there's always risks with everything we do, those risks are very low, and the benefits of the procedures far outweigh these risks. And so a good majority of patients undergo same-day procedures. They come in the morning, whether it's at a surgery center or at a hospital, and they have the procedure done, and they walk home the same day, a few hours after the surgery, with small, tiny incisions. Now, in the past, there used to be large incisions, and there is damage, you know, unnecessary damage. Nowadays, we limit our access to the areas that cause the most amount of pain through tiny incisions where the patients really might have some soreness afterwards, but the goal of the procedure is pain relief and restoration of function. So if they're having problems moving or sensation after the procedure, they should feel those sensations return over time and have motor function return. And these procedures that we perform the big procedures and we perform the minimally invasive procedures. And the minimally invasive procedures are always better for a quick recovery and back to normal, being the mom, being the athlete, being the, you know, the hard worker, the professional.
Right.
So.
With ultimately recovered from the life you were living beforehand.
Absolutely.
Anyway, you look at that. So, and Erica, you are a big proponent for get informed. Just learn what's out there. Education helps to alleviate some of that fear that patients have. Like maybe this is the first time ones have heard about, oh my gosh, you're kidding. I'm not going to have a scar that's 6, 8 inches long on my back. This is amazing. So one of the things that you are providing on your website is an ebook. Talk to me about this ebook. And by the way, this is free. This is free. This is how passionate Erica is about wanting you to be informed, have the right resources, have the education to alleviate those fears. Talk to me about this.
Sure. So, yeah, in talking to many, many patients over the years, we found the kinds of questions after they had the procedure where they said that I'm better, I wish I had known this before, I wish I had asked these questions, and so we compiled all those questions as information. what questions to ask your doctor. And we put it into this free resource that can be downloaded. It's called Critical Factors for Successful Spine Surgeries. And it also talks about all the different types of procedures that are out there now and options for the patient. Even pain scales, so you can address your own pain. But the big objective is to put this a free resource into the patient's hands.
And you can get that. I know you at home right now are probably thinking, I need that. I need it right now. Where is it? Right here, backpaincenters.com. Backpaincenters.com is the website. We'll have a link for you on ours. We'll be back. As always, I want to thank you at home for joining us, and thank you guys for being here. It's most informative. Keeping in theme with informative, log on to backpaincenters.com, or we'll have a link for you on our website as well. Until next week, have a great one.